Good afternoon, everyone. I'm Carlos De Leon, Senior Associate with NASTAD's Health Equity and Prevention team, and I'll be facilitating today's webinar. I would like to thank you all for taking the time and joining us today on this webinar titled Adapting Social Marketing Campaigns for Health Departments. The subject of social marketing for this webinar came about from CDC funding announcement PS 12-1201, which allows health departments to allocate up to 25% of its core prevention funding to support other proven HIV activities, such as social marketing. NASTAD has been assisting health departments with developing and deploying their social marketing approaches and anticipates the information shared in this presentation today will be helpful to our members. Before we get started, I would like to review a few webinar etiquette tips and introduce our presenters. As a friendly reminder, this webinar is being recorded. Also, all lines are currently muted. To unmute your line, please press *7, and to remute your line, please press *6. There will be a question and answer section at the end of this presentation where you'll be able to express any verbal questions you have. Also, if you have any written questions, there's a chat function at the bottom right corner of this webinar, and you can add your questions whenever throughout this presentation. Today we have with us Michael Carfan from the District of Columbia Department of Health, HIV/AIDS, Hepatitis, STD, and Tuberculosis Administration, also known as HAHSTA. Mr. Carfan has worked with HAHSTA since 2006 and will provide us with a brief description of his experience developing social marketing campaigns and work with Octane Public Relations and Advertising. Next, we have Elaine Miada, Executive Vice President at Octane, and she will be presenting on developing social marketing campaigns, her work in the District of Columbia, and how social marketing campaigns can be adapted for health departments. Ms. Miada has worked with the DC Department of Health on several social marketing campaigns, which have received a series of industry awards. So without further ado, I welcome Michael Carfan to share his.
Thank you, Carlos. Good afternoon, everyone. My name is Michael Carfan. As I said, I am the Senior Deputy Director, or the Director for the HIV/AIDS, Hepatitis, STD, and TB agency here in the DC Department of Health. Prior to that, I actually managed and developed our social marketing program. We started about 5 years ago, or 6 years ago, and it came for the development of the program came from the notion that first that social marketing, public information was an important component of our public health strategy towards reducing morbidity and addressing the burden of disease in our jurisdiction. And we used as the formulation of that data using our epi data, our behavior core surveillance data, using our behavioral surveillance data as the driving elements as to developing our program target populations and the focus areas that we would be working on, as well as our programmatic approaches, so our core strategies that I know that across the country we've been using around expanding HIV testing, linkage to care and retention and care, and then large-scale prevention efforts, at-scale community-level interventions around public sector condom distribution, needle exchange, and other strategies of engaging our provider community in terms of addressing, making HIV in particular a routine part of our healthcare system. And we went through a competitive process to select a vendor to be able to implement the program, and that was awarded to Octane Public Relations and Advertising. And the other context that I would like to put in this is that we really follow the principles around social marketing, and social marketing being that you're using commercial marketing strategies to develop your campaign approaches, both the creative, and then to do that it required doing formative research, both literature reviews, but also to do qualitative research through the use of focus groups. And that has been a consistent part of our program over the 6 years, which has been to constantly engage focus populations in terms of testing our creative material, testing of the strategies that we're implementing, the way individuals obtain information, what are the messages that will result in behavioral change. The other aspect of this has always been, because we have limited resources and we're actually also in one of the more expensive markets in the country, was that just information for information's sake was not going to be our approach, that we really needed to have as a framework of our program to attach directed action into all of the elements of our campaign messages. And that as well, the other piece of that is, which is the much harder piece of any social marketing program, is to be able to do some evaluation of that and to assess, are people getting messages, are these messages having an effect? And I'm sure Elaine will be sharing some of the results of the evaluation component of the program. So it's been a very collaborative process. We've also engaged our community in this, so our community partners have been always an active participant in helping us develop messages. We've also included and have regular communication consultation with Octane as we change program directions and as we look at where our new program opportunities are afforded to us. We're here in the district, we're now embarking on expanding our and actually implementing pre-exposure prophylaxis program and PrEP, and we're going to be developing social marketing to accompany that. And so engaging with our academic partners and our community partners and our communication partners in part of that process, and that's been a consistent element of what we're doing as we've implemented this program. So it's been a very successful partnership. The last part that I will say in terms of any in the years that I've been working in this field and the years that I spent actually working directly in sort of communications work, is that any successful campaign is going to be, and successful working with a vendor means that you actually have to manage that vendor. And I know that not all of us have the direct experience in working in social marketing or in communications, but the directions, the approach really has to come very much from the health department, and that to me has been an important element of our success here in the district.
Thank you, Michael, for sharing your insight and experience. And now I'm turning the floor over to Elaine.
Hello, everybody. So I'm going to walk you through some of the lessons we've learned in working with the DC Department of Health and Michael with the social marketing campaigns that we've done for DC. And at the end, I'll also walk through some of our evaluation from one of our campaigns and what we learned. And definitely will be open to taking questions from each of you specifically about our campaigns or anything that I talk about today. So just to give you a brief overview of the presentation, I'm just going to offer really some key insights and tips on developing effective HIV/AIDS social marketing campaigns. So we're going to talk about everything from research to audience segmentation, message development, and outreach channels. And then we're going to walk through kind of how to evaluate your efforts and a brief overview of key findings from our survey that we did of our social marketing campaigns as well. So as we all know, the most important part of any social marketing campaign really is the research. If you do research well, you are able to really find out what your target audiences has misconceptions about, needs more information about, or what direction your campaign should go. So the way we approached research for HAHSTA was really to first identify what the problem is, and this is where, HAHSTA has the data that shows where the issues are with HIV/AIDS in DC. So they were able to identify the areas that they wanted us to focus on. If you don't have someone in your organization who does research, I would recommend engaging a research consultant to help you through the research process, or someone that has an understanding of how to do effective research. I know at Octane we engage a research consultant to help us with developing moderator guides, questions, and developing a plan that we can really implement. Then you need to really determine what your research needs are for your project. Are you going to do focus groups, intercept surveys, online surveys? There are various different forms of research, so determine what you want to do. Develop your questions, and then, of course, conduct your research and create a report which will then inform your program. So as I'm going through this, I'm going to be talking about a program we did for HAHSTA around HIV testing. And I've put here at the bottom of the slide the problem that HAHSTA was trying to resolve, which is that in 2009, HAHSTA found that many residents were still not being routinely tested for HIV. So that was the problem that we were charged with tackling. And then in terms of types of research, there's also environmental scan in addition to focus groups that you can do. Environmental scan is probably one of your most cost-effective forms of research, because really it involves reviewing existing research and campaigns and what's out there in the marketplace, and seeing what's working and what people are doing to help inform your project. Typically at Octane, we always start with an environmental scan, because that also helps inform our research as well. And then focus groups with your target audiences, definitely surveys, and stakeholder interviews with community organizations and others. So Octane, as Michael mentioned, this is a very collaborative process. So in our research, we did engage community-based organizations in helping to recruit focus group participants, in getting their input on the research phase so that they would be bought into the program as well. And then once you have your research and your report and your key findings, that's when you can kind of really dig in to define what your campaign goals, objectives, and target audiences are. In terms of audience segmentation, it's really important to identify who your core target audience or audiences are so that you can tailor your message, because if you haven't kind of narrowed it down, it's really difficult to reach a broad audience with a really general message when you really want specific people to take action. So for the HIV testing campaign, we defined our target audiences as heterosexual African-American men and women in D.C., as well as gay men in D.C. And that was based on the research that showed that these were the audiences that weren't getting tested and that were at the highest risk for HIV. So we decided we wanted to really focus on them for this effort. And then once you've determined your target audience, really you need to think about looking at your research and determining what your goals of your campaign should be. Goals of the campaign can include raising awareness, informing or educating your audience about something, working towards changing their attitudes or behaviors, promoting goodwill. So it's really important to try not to accomplish a lot in one time. So having a specific goal that you can really aim or focus on is important. So for the DC HIV testing campaign, we came up with 2 goals that we wanted to accomplish. And one was to inform residents of the importance of requesting an HIV test during their regularly scheduled doctor visits. And then the second was to motivate residents to learn their HIV status for their health, the people in their lives, and communities. So we felt that these goals were enough because it was really, this was going to be more of an information and motivational campaign to get people to take action. And then for campaign objectives, I'm sure some of you have heard the term Be SMART, which is make your campaign objectives specific, measurable, achievable, realistic, and timely. It's really important to do that because if you don't have SMART objectives, then you won't know whether you're really achieving your goals. Your objectives are a way to track towards your goals. And then they also help you monitor, like, you know, is a tactic really working well? You want to invest more in that tactic. If a tactic isn't working so well, you may want to pull back, or determine how you maybe want to shift that strategy or that tactic so that it can be more effective. And so for our objectives for the HIV testing campaign, we said that we would create messages and resources that provide DC residents with information about the importance of HIV testing. We disseminate this information using advertising, social media, a website, and through our work, our collaboration with community organizations that do health outreach. We also conducted earned media to promote the campaign and highlight stories of HIV testing as prevention. In addition, we engaged DC residents at events to inform and motivate them to get tested. So these objectives really helped us to determine, okay, are we meeting our goals? Are we creating messages and resources? Are we disseminating them? Are we conducting earned media? And are we engaging residents at events? From there, once you have your target audiences, your goals and objectives, you really want to kind of define what you want to say to these audiences that will help you reach your goals and objectives. So one of the first things we did for DC Takes On the HIV testing campaign was develop a theme or a tagline. And really what that is that becomes kind of synonymous with your goal or your brand. It should really convey what you want people to do, or convey some kind of aspirational or meaningful statement that people will be able to latch on to and be able to say, this is what the campaign is about. So for us, our campaign theme became Ask for the Test, because that's simply what we wanted people to do, to go to their doctors and ask for the test. And we knew it was something that would be simple and clear and help that people could remember when they were at their doctor's offices. The most important part, I think, once you determine your tagline is, what are your supporting key messages that will tell the story that you want to tell? So really, your key messages are like your elevator pitch. If you were on the elevator with somebody for 30 seconds and they said, tell me about this campaign, what are the maybe 30 or 90 seconds of information that you could give them? You know, what is the campaign, how is it beneficial, and why is it important? And key messages really help you prioritize the information that you want to share. They make sure that anyone who's involved with the campaign can be consistent and accurate with what they're presenting about the campaign, and also help you stay focused when you're presenting. So whether you're presenting to the media, whether you're at an event, whether you're talking to a community person, you can have the same consistent key messages across those audiences. So I put on this slide some of the attributes of key messages. Really, you want to make sure they're concise. Typically, we talk about doing 3 key messages with 3 supporting sentences under them. you want to make sure they're strategic, so they make sense, so they really address what you're trying to do in your community as opposed to maybe some broader effort that's happening. And you want to make sure they're relevant to your audience as well. Sometimes there's a lot of different information you can give your audience, but really what's important to them is what you want to include in your key messages. You also want to make sure they're compelling, because if it's not compelling, people aren't going to act or listen. Keep it simple, make it memorable, use active voice rather than passive voice. And as we talked about, not only make it relevant to your key audiences, but tailor it to them. So if it's something, like, for example, DC takes on HIV, you want the messages to talk about what the impact of HIV is on DC residents, because that will resonate with them. That's something that's real and meaningful to them and speaks directly to your target audiences. I often use the message box method to develop key messages. So, you put a box, you create 3 different areas, and then you list your messages that way. So, for example, for the DC HIV testing campaign, in our message box, we did a box that was about, what is HIV testing, who should be tested, and then we included some statistics around HIV testing in DC. So these target audiences would know, hey, the rates of HIV are high among African American men, among MSMs, so that they're aware of why we're targeting them with this information. This is an important step that a lot of organizations skip because it seems really complicated, but it's really important, and it's not difficult once you kind of get in the practice of it. So I really encourage you to, if you haven't done a message box before, maybe having a communications consultant come in and help you develop one is a great way to get in the practice of learning how to develop one and getting comfortable with it. And then the next thing, once you've gotten your goals, objectives, target audiences, and key messages, you want to focus on your branding and creative. And you want to develop a brand or creative that can drive your campaign. As we know, all successful brands are really recognizable. They're memorable. The brand complements the key messages. And really, you want your target audience to have an affinity to your brand and a connection to your brand when they see it. So branding can include your logo, your colors, your fonts, the images you use, the messages that you use in there. And also, branding is important because then when somebody sees that look and feel, they'll know it's tied to your campaign. If you have different looks and feels, people may not know, well, who's putting this message out? Why is it being put out there? So just consistency with your branding is very important as well. And here I've put two of the brand and the creative that we came up with for Ask for the Test. So we did this bright yellow sign with the Ask for the Test on it, and then we decided to do photo shoots with real DC residents holding the signs, saying, when I visit the doctor, I ask for the test, and giving some information, a website where people could go, they could call 311 or they could text to get more information. But what was really important about this is that no matter where people saw this Ask for the Test sign or the ads, they knew it was HAHSTA's campaign. They recognized it. It was really consistent. The look and the feel of the ads is very similar for everything. And then once you've done that, it's really deciding what are my most effective communication channels for your target audiences. So you want to decide what is the most effective way that I can reach them with this information. And we know that that can include earned media, working with community partners, developing resource materials, going to events, advertising, the use of social media, having a website, maybe video. There's a number of ways you can reach people. So you really want to pick, what are the most effective ways. And a lot of times your communication channels are dependent on your budget. So, you really want to think about, is my budget enough to sustain, a 6-month, advertising campaign? And if it isn't, then you may want to look at, well, maybe we only do 1 or 2 months of advertising, but the rest of our time is spent doing resource materials and events and social media to get the word out there. And definitely a website is a great way, if you do have some limited budget, to make sure your campaign message stays out there. So for Ask for the Test, we use the following communication channels. We had the website, we had a TV ad, we had transit advertising as well. We did collateral materials, so brochures, palm cards. We also did outreach at events as well as earned media. So those were the tactics we used, and we really based these tactics based on where our target audiences were and how effectively we thought we could reach them with these communication channels. So once you've implemented and launched and been out there for a while, it's really important to think about, even before you launch, how you want to evaluate your efforts. So what things are you going to do to ensure that you're meeting your mark? For evaluation, the first thing you need to decide is what program elements you're going to monitor, and determine how you're going to gather the information. So, how are you going to get the information you need? Is it, media monitoring? Is it, if you're doing paid advertising, is it reports from the advertiser? If you're doing materials, is it the number of materials you've distributed? Events, is it, monitoring how many people you've reached, how many events you've been to? And then you need to develop a timetable and budget so that you know how much is it going to cost me, who's going to be doing these activities, because you do want to make sure that someone is always managing these activities. So there's quantitative and qualitative evaluation. For quantitative, you're really looking at just numbers. And I've listed here some of those ways you can measure quantitative. So website traffic, social media likes, comments, hits and responses, partnership results, paid media impressions, earned media impressions. So those are typically a little bit easier to collect. That data is a little bit easier to collect. The qualitative is where you have to do a little bit more work, and this may involve going back to those target audiences and doing focus groups with them after the campaign has been out there for several months to see what their reaction to it has been. Did it change their behavior? Did it lead them to get more information? It may include interviews with key stakeholders that help you develop the campaign to see what they thought about it. So, evaluation is a big piece, and I would encourage you that as you're developing your objectives, that you be thinking about evaluation in tandem with your objectives. A lot of times we wait to think about evaluation until after we've gone through the creative and all the things for the campaign, but it's really important that as you're looking at your objectives, and especially your communication channels, that you know what your evaluation metrics are going to be, so that you can know whether, A, do we have the resources in-house? Do we have to get somebody outside to help us with this? And how effective can we really be doing this as well? So that concludes kind of walking through the elements of really adapting and making sure you have a strong social marketing campaign. Now I'm going to briefly walk you through some of the key learnings from our HAHSTA research report, which we actually released last week. And this, I'm specifically going to focus on Ask for the Test for this presentation. And so our work at Octane started with HAHSTA back in 2008 when DC had one of the worst HIV epidemics. We had about 3% of the population infected in DC with HIV, And that's when we got the contract with HAHSTA to begin working with them to develop social marketing campaigns. So one of the first campaigns we developed was the DC Takes on HIV campaign. And that's kind of the umbrella for any of our other campaigns around treatment, prevention, testing that we develop for DC. And so Ask for the Test, as we just walked through, was really focused on getting people to get tested for HIV because we knew testing is a form of prevention. If people are getting tested and they know their status, they can do something to prevent infection or get into treatment if they are infected. So this was a campaign that we felt was very important, and working with HAHSTA, looking at the data and understanding who needed to get tested, we really developed a campaign that would speak to those audiences. So our methodology for evaluating this campaign was we did a phone survey, and Braun Research actually did the survey for us with DC residents over 18, and we oversampled our key target audiences for this effort, so African Americans and men who have sex with men, because we really wanted to see how this campaign resonated with those two target audiences. So in the next slide, you'll see that these are the demographics. So we interviewed around 810 participants, and we had a pretty good mix of male and female and age ranges. And as you can see, we focused largely on the younger age range as opposed to the older age demographic, just because that was the age range where most of our outreach was focused on for this campaign. So what we found out was that of those that were surveyed, 39% said they were familiar with Ask for the Test, which is incredibly successful. We know that, many times you put out a campaign out there and maybe you're lucky to reach, 10 to 12% of your target audience. So for 39% of those that we talked to say that I'm familiar with Ask for the Test, I saw it, I heard about it, I had some kind of frame of reference for it. It was really just further proof that this campaign, the research was very effective, the target audiences that we selected were people who were paying attention. And then when we asked them about, what did you see about the campaign, the top two things that people recalled were the television ad and the transit ads that we ran. We, of course, also did, as I mentioned earlier, events. We had a website. We had collateral materials. People mentioned those as well, but they were below TV and transit advertising. So this was helpful for us to know for the next phase of Ask for the Test, because then what we can do is we can tailor our outreach to really focus on those channels that were most effective at reaching people. When we asked people when we asked about what impact this campaign had on their awareness, attitudes, and behavior, what we learned was that the majority of people said, over 50% said that, this campaign really made me think about getting tested. About a quarter of those people who saw the campaign, 24%, said that campaign actually made them go and get tested. So they actually took action as a result of the campaign. Some people said, I didn't take action, but I went and got more information about HIV. I went and, talked about it with somebody. I picked up a flyer. I just found out more about my risk for HIV, which is still excellent because at least this campaign was making people think. It was making them take some sort of action, whether it was getting tested or just getting more information, or maybe even taking precautions, more protective behaviors as well. We also found that there were some gaps with the campaign, and one of the primary gaps that we found with the campaign was that a lot of people said that their doctors weren't offering them the test, or talking to them about getting the HIV test. I think we found about 52% of doctors were offering the test, but about 46% weren't, which that's a really high percentage, because we know if doctors recommend or offer the test to patients, it's more likely that patients will take the test. So finding out that gap, we know that there's work we can do in the next phase of the campaign, and just getting the information to doctors and urging them to recommend the test to their patients. And then the other piece that I think was really, really encouraging to us was that a majority of the respondents said that the campaigns were really helpful to them. So DC Takes On HIV, Rubber Revolution, and Ask for the Test were really helpful to them. The campaigns not only reached and educated their intended target audiences, but we were able to deliver a relevant message to the audiences that helped to encourage them to get tested or have more positive health behaviors that would keep them healthy, that would get them into treatment if they needed treatment. So we were really encouraged that, this showed that there is a really big need for social marketing campaigns like this that educate and move audiences forward and help them to make the right choices when it comes to their health. We also found that 2/3 of the survey respondents were aware of free and confidential HIV testing services in DC, which was very encouraging as well, because that shows that, people know that they can get tested. And what's great with the ACA is now most people have health coverage, so not only could they go to their doctor, but they have other options as well. And the biggest key learning was really from the campaign, more DC residents are likely to ask for the test, which is what we wanted to do with this campaign. So we felt that we had made that change. In terms of the next steps for the Ask for the Test campaign, we actually just finished doing a refresh, doing some new creative for the campaign, which actually launched this week. And we'll be, kind of revamping our outreach efforts to tailor them to be more effective towards our target audiences. And since we know the campaign has been effective and we know people are paying attention, we'll be just really making sure we're continuing it so that we continue to help DC residents take on HIV. And that concludes my portion.
Thank you so much, Elaine, and for that great presentation on social marketing. Now we're going to open up the floor for questions. On the slide that's on your screen right now, just to review, *7 is to unmute your line, and *6 is to remute your line. And please be cognizant of any background noise. And so the floor is open for any questions. So since I'm not hearing any questions, I actually have a question for you, Elaine. So basically, how can a health department with limited funding and resources partner with a company like Octane?
Hello?
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 Hi. So I'll answer the question. In terms of partnering with Octane or a company like Octane in your area, what I would recommend that if you have limited resources, I would recommend reaching out to their PR companies or smaller companies that sometimes do pro bono efforts or would be willing to at least do a consultation with you. So my recommendation would be to reach out to a company whose work that you've seen or that you're aware of, that you think you may want to work with, and talk to them and see what they'd be willing to do, because I know a lot of times, we make the assumption that, we can't afford it or our budget isn't big enough. Let them know what your budget is. If you don't have a budget, let them know what kind of assistance you'd like from them. Find out if they're willing to do, any pro bono work with you or even help you with a specific portion of your project. Another thing you can do is also go to professional public relations organizations. Like in D.C. we have the Washington Women in PR, the Public Relations Society of America. Sometimes they have local chapters. You can approach them to see if there are people within their organization who are looking to build their portfolios or to get pro bono or freelance work. And that's a way to cost effectively get help as well, because you have people out here who are looking for a way to expand their portfolio who may be willing to work with your organization.
Thank you, Elaine. Another question came in through our chat message, and it's asking, what can small organizations do to create an evidence-based campaign? Time is needed to create them, but grants often are restricted.
Yes, I definitely understand the time restrictions that sometimes, puts you in a bind. My recommendation would be that if you're really on a tight timeline, that you really kind of have to shrink your research and campaign development time down, and maybe, use existing research and existing information to help inform what you're going to do. So spend less time on the research phase and spend more time on really your planning phase and implementation phase. So if that means, maybe just doing like 30 days of research, then moving into your planning and implementation, then, I would definitely recommend that.
Hello?
Yes.
Yes. My name is Derek from Philadelphia, and my question is that in terms of your target audience, you basically were targeting African Americans in D.C. and basically gay men in D.C.
Mm-hmm.
And that's a fairly broad audience to be going after, with so many different levels of differentiation between race in terms of the gay community, economics in terms of both the gay and African American community, and all of them need to be reached in different ways in order to be effective. And I'm wondering, was there any discussion between in terms of going to a narrower and more focused high-risk target audience as opposed to a fairly general audience?
I'm sure there was a lot of discussion around it. I think when we selected these audiences, we're definitely aware that there are even variations within these audiences. And that's why advertising was a big piece of this campaign, because advertising really allows you to reach those broader audiences within the African American and the gay community. And we really tried to include people from those communities that we felt other people would be able to relate to in the imagery for our campaign as a way of trying to reach them. And really where we were able to do most of our micro-targeting was really the event outreach. So the types of events we went to and the types of people we could reach at the events. So, unfortunately, we couldn't go really much we could go much narrower, but we used tactics such as, the events to do the narrow focus and the community organization partnerships. So there were community organizations that focus on reaching specific subsets of these target audiences that we worked with to make sure that we sent materials to, we went to their events, and did outreach with them. So that was our way of kind of micro-targeting within these communities.
I see there are some health departments. Hi.
I a question. So in regards to what the budget is now, and for our funder, the CDC, wanting us to use their existing materials, Act Against AIDS campaign in the community, what would be your recommendation for making it your own? Not starting necessarily from scratch.
Right.
Mm-hmm.
Well, I would say, I know CDC typically shoots a variety of different images. I would say select the images that are most relevant to your community, and then I would say create tailored messaging for your community. So, CDC's message is kind of broad. So I would say, are there stats, is there information that's specific to your community that you can push out via social media, via a website, via events? Or can you do a brochure that may accompany an Act Against AIDS information? Or just a palm card, which is really cheap, maybe just a front and back palm card that's specific information that's tailored to your community. Social media is a great way to push out information that's really specific, that allows you to be more tailored than, let's say, the Act Against AIDS broad and general campaign. So those are a couple of the things that I would suggest to kind of think about.
And I just add to that one of the things that discovered in when we were doing the initial development of the campaign is that when we surveyed people or questioned people and did focus groups and asked them about messages that were in the community about HIV, and being here in D.C., there's actually a fair number of the national campaigns that have been going on. People's answer was, there's nothing here. And the fact that because it didn't reference D.C., didn't reference Washington, and if there's any way that when you look at if you're going to use some of the CDC campaigns, and I'll say that they've developed some much nicer campaigns recently, that if there's a way to get your jurisdiction included in there, tagging that in some way, because that's what people look for. They look for something that relates to them and where they live. And that's what we found is all of a sudden people started to recognize messages around HIV because DC was included in that.
Yeah, and definitely co-brand. If you can put your branding on the Act Against AIDS material, put your website, your logo, put local contact information, things like that people can recognize, that's also helpful.
Do we have any more questions from audience members? All right. Well, hello? Well, if there's no more questions, I would like to thank everyone for participating in this webinar, and I wish you a great end of your day.
Hello. I'm sorry. I got one last question. Hello?
Go ahead.
Yeah.
Will this PowerPoint presentation or the recording be available for later use or viewing?
Yes, it will be. We will distribute it to everyone who attended.
Thank you so much for answering my question. It's great. I appreciate it.
No problem. Thank you.
All right. Bye-bye.